So you've heard people talking about this thing called an IT band, but you're not really sure where it is, what it is, or how it can cause you pain. If you've got these questions, stay tuned, I'll explain all. Plus, I am doing a free giveaway at the end that you don't want to miss out on, especially if you have IT band problems. Hey, I'm Steph. I've been a physical therapist for over 12 years and a runner for over 20, and I've helped so many patients get back to running injury-free that I wanted to help some of you too. Today I'll explain what an IT band is and more. Before we get started, please hit the red subscribe button and the bell so you get notified every time I release a new video. And visit my website to learn more tips and tricks on how to stay happy, healthy, and on the go. You just saw a picture of a runner because most likely if you're watching this video, you are a runner of some kind. IT band pain or syndrome is very common in runners. I'll explain why after I tell you what the heck an IT band is. Our IT band is just that. It's a thick fascial band that runs from the top of the pelvis, outside of the pelvis, the ilium bone, down the side of your leg, and attaches below your knee on the shin bone or the tibia bone. Hence its name, the iliotibial band, IT band for short. At the top of the pelvis, it attaches into your big glute muscles, your gluteus maximus, as well as a hip flexor muscle, a muscle in the front of your hip called the tensor fascia lata, or TFL. Because it crosses both the hip and knee joints, it acts to help stabilize those joints during activity. If there's weakness in some of the muscles around the hip, specifically the hip abductor muscles, those side hip muscles, and then some of the deeper ones, the hip external rotators, that can cause a breakdown in our movement pattern. Walking form and running form, something's breaking down, and that creates friction of the IT band over those bony parts of your hip joint and knee joint. And over time, if that continues and that friction, that IT band gets really tight, causes that friction, that can cause some pain and an inflammatory response. Because of that, the IT band itself actually gets stuck and doesn't move like it should, which again causes more irritation to some area along that. Other things that can cause irritation are if you have maybe one leg that's longer than the other, which is not uncommon, it's actually very common, but depending on all of these factors, as well as the activity you're doing. So that's why I'm tying this into running, because it is very repetitive, step over step, for miles and miles, and if something is not working properly, there's a breakdown in your form, then something gives. And a lot of times it's the IT band because of the repetitive motion and the repetitive rubbing then on the IT band over those two joints. So if you are walking and running a lot, if you're going up and down stairs a lot, those activities tend to be where people notice it the most, because it's that swing of the leg that is when the IT band tends to glide over those joints. So if you're feeling like a nagging pain on the outside of your hip, or maybe down at your knee, outside of the knee, you could be experiencing IT band problems. It is a very necessary connecting band that we need to help stabilize, but it can be a big pain if it's not taken care of right away. So stay tuned for the next video. I'm going to show you how to treat IT band syndrome, or if you're having pain in these specific areas, I'm going to show you how to treat that. And now that brings me to my giveaway. So I'm going to give away 2 Perform Better exercise bands that if you are having problems with your IT band, it will help you to treat it, which I will show you how to do in the next video. So all you have to do to be in the drawing, I'm going to randomly pick 2 people. You just have to comment below. Comment anything you want. It can just say, pick me, and I'll put you in the drawing and we will get you those Perform Better exercise. They are not a sponsor, by the way. I just really like them. I hope this was helpful. If it was, please give me a thumbs up and share with your family and friends, and I will see you next time.